Greetings, I'm Dr. Max Gomez here at the 5th International Vatican Conference, and I'm here with Shelley Lyford. Shelley, welcome. Thank you for your time and your insights today.
Thank you, Max. I'm so happy to be with you today.
Let's talk first about the Vatican Conference, because I'm sure that you go to so many of these medical conferences and other types of conferences, and they tend to be relatively narrowly focused. What about the value of this kind of a very broad focus, multidisciplinary conference?
Well, Max, it's so important, and it's important on a whole host of different levels. First, it takes a more holistic view of the issues that are really affecting the world, and it also provides a diversity of perspectives. You cannot look at high healthcare prices without also looking at the inequities in the system, which includes race, income inequality, for the work that I do, ageism. And we also have to remember that health happens outside the four walls of a hospital. And the experts that are gathered here at this conference, they give us their fresh perspectives. They give us best practices and also bold solutions that we can use to confront and fix broken healthcare practices and systems.
So speaking of healthcare practices or things that might be broken, that I think a lot of people might agree, let's talk about drug prices, because that's been in the news a lot. And I think everybody can agree that they're very high, but not everybody agrees on what we can do about them. What's your point of view on that?
Max, from my perspective, the best way to fix high drug prices is through allowing Medicare to negotiate. Medicare is the biggest purchaser of drugs in the United States and has effectively been neutered by not being allowed to negotiate. It would take an act of Congress to change this, and I am hopeful that this 117th Congress will have the courage to stand up for patients and Americans who have to choose all too often between paying for their mortgage or paying for their life-sustaining medicine. Beyond the bold solution of Medicare negotiating, we can also look at greater transparency, more regulations, and value-based payment reform. And also supporting nonprofit generic companies like Civica RX. Those models guarantee supply chain, and they also are transparent in their pricing. This is pivotal. These will be incremental steps until we can get to Medicare negotiating.
Well said. So I think also we can all agree that there have been terrible inequities, health disparities, health outcome disparities in our system. And then COVID really exacerbated those and shone a very bright light on that. What do you do? What do we do about that? How do we go about trying to fix that, or at least make it better?
So, Max, without question, there are great inequities in health systems around the world, and COVID-19 has shined a light on the fragility of these systems. I wish I could say I was surprised. But beyond the staggering death toll, the coronavirus has magnified issues that many Americans already faced, especially many older Americans, like isolation and depression, financial insecurity, navigating a broken healthcare system, malnutrition, and the list goes on. Max, our research at the Foundation has found that 18% of adults in the United States, or a staggering 46 million people, avoided seeing a doctor during the first year of COVID due to the cost. And that same number say they simply cannot afford healthcare today. The findings are even more illuminating and alarming when viewed by race. While an average of 16% of white adults said they couldn't afford healthcare right now if they needed it, the share is even larger for people of color. 29% of Black and 21% of Hispanic or Latino adults said they cannot afford healthcare or drugs in the United States. But Max, the inequities do not stop at cost. Where cost ends, access begins. There is a serious lack of medical infrastructure in every single corner of the United States and the world. Take, for instance, access to the vaccine. Our research has found that in some communities, both rural and suburban. More than 50% of seniors must travel more than 10 miles to their closest vaccine center. And let's consider how even 1 mile is insurmountable for many seniors who don't have access to transportation or don't have a caregiver who can give them a ride. 1 mile max. 1 mile. We should be ashamed. We have to do better, and we have to address equity and access and make our healthcare affordable, not only for this generation, but for future generations.
Absolutely. Shelley Lyford, thank you for shining a light on our healthcare inequities and helping us figure out what we need to do about it. Thank you for your time and your insights.
Thank you, Max.